Have you ever experienced a persistent, uncomfortable feeling in your bladder, like it just will not calm down, even after you have used the restroom? It is a common experience that many people face, and understanding what is behind it can be very empowering. Chronic bladder irritation can be caused by a variety of factors, including persistent infections, certain dietary choices, underlying medical conditions, and even lifestyle habits. It is essentially a prolonged inflammatory response or dysfunction within the bladder itself, leading to ongoing symptoms that impact daily life. The primary reason for chronic bladder irritation often boils down to continuous exposure to irritants or a sustained inflammatory state. One major culprit is recurrent urinary tract infections, known as UTIs, which can lead to inflammation and damage if not fully resolved. Another significant factor is interstitial cystitis, often called painful bladder syndrome, a chronic condition where the bladder wall becomes inflamed and painful without a clear cause like infection. Furthermore, certain chemicals and compounds found in food and drinks, such as caffeine, alcohol, and artificial sweeteners, can directly irritate the bladder lining. Neurological conditions that affect nerve signals to the bladder can also disrupt normal function and cause chronic irritation, leading to symptoms like frequent urination, urgency, and discomfort. Even pelvic floor dysfunction, where the muscles supporting the bladder are too tense or weak, can contribute to these ongoing irritating sensations. To help identify potential causes for your specific irritation, a healthcare professional might suggest keeping a bladder diary to track fluid intake, dietary triggers, and symptoms. They might also recommend urine tests to rule out infections, or in some cases, imaging studies or a cystoscopy, which is a procedure using a thin scope to examine the bladder lining. Avoiding common dietary irritants such as citrus, spicy foods, and carbonated beverages can often provide some relief. Staying well hydrated with plain water is crucial as it helps dilute urine, making it less irritating. Understanding the specific source of your bladder irritation is key because bladder health is a surprisingly complex system, involving not just the organ itself but also surrounding muscles, nerves, and even your gut microbiome. For example, some research suggests a link between gut health and bladder irritation, highlighting the body's interconnectedness. Also, chronic irritation can sometimes be a subtle sign of other conditions, like kidney stones or even bladder outlet obstruction, making professional evaluation especially important. By identifying and addressing the root cause of your chronic bladder irritation, whether it is through managing infections, adjusting your diet, or treating an underlying condition, you can significantly improve your bladder comfort and overall quality of life. This proactive approach helps to restore balance and reduce the persistent discomfort, enabling you to feel more in control of your health and daily activities.